better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Maggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Welcome, everybody, to No One Told Me, the Airway Health Connection podcast. I'm Dr. Liz Turner. I am so excited to have our guest here today, Claire Ferry of Vital Brain Neurofeedback. We serendipitously met because you saw something I'd post and a mutual connection. You're like, I'm actually in Colorado. And turns out we were both in Colorado 20 years ago being ski bums at the same time, working with the same people in the same restaurants. So sometimes life just kind of comes full circle. It's weird.
Yeah.
But that's why I'm just so happy to have you here today, because we've reconnected professionally and it's so amazing what you can do for patients. So Claire, why don't you go ahead, tell us who you are, where you're located, what you do, how you got started.
Yeah. Thanks so much for having me. Yeah, it's crazy that our Colorado stories, like we're so similar of how we started here. And thankfully we're not in the same places that we were then in life.
Yeah, I looking back, I would do it all over again because it sure is fun living in a ski town with a lot of great people. And I'm glad I don't have to go through schooling and like figuring out what I wanted to do professionally and all that stuff all over again. It's kind of like saying like, let's just go back and do high school over, but also let's not because, you know.
Just all the fun parts.
Mhm.
Well, yeah, thanks so much for having me. I'm Claire Ferry. I'm the owner of Vital Brain Performance Clinic. So we do brain mapping and neurofeedback for children and adults. And our business is totally remote. So all of our clients train from the comfort of their own home. I guess a little backstory on myself. I'm a mom of four. Their ages 3 to 10. Our I don't think I ever had like anxiety or anything. I don't think, but I now I believe I do, but I didn't think I did originally. I definitely have like childhood trauma that I see now. But when I became a mom, anxiety and depression, like postpartum anxiety, postpartum depression, and sleep issues just really hit me super hard. So, our son had a lot of health issues, our sweet little boy that you're working with right now.
He's the best.
And then when he was like 5 or 6 and our baby was a year old, my anxiety, sleep issues were like really bad. And our oldest has also ADHD. So he was behaviorally like off the charts. And we just had really gotten to a pretty hopeless place. You know, like if you have multiple kids, you parent them all differently. Their like currency's different, different for each one. Anyway, I'd been on medications before, weaned off, didn't want to do that again. And when we were just in a really hopeless spot, I reached out to another friend that owned a neurofeedback clinic, and she really encouraged us to do remote neurofeedback. So myself and my son did neurofeedback together. And it really it sounds so silly saying it, but it really did turn like a hopeless situation into a really hopeful situation. It made me, I really think it saved me as a mom. I'm definitely a very different mom to my, 3-year-old than I have been to my 10-year-old. So,
And you homeschool. Like that's a whole nother level of patience and autonomy that you've undertaken.
yeah, and I really I've reflected back on neurofeedback, and it really was the catalyst to like so many really positive, healthy things in my life. Like I ended up stopping drinking alcohol. I've been working out a lot. And yes, like you said, I ended up homeschooling my kids. That was never in the cards for me. I was the mom that said, I'll never homeschool. I cannot do that. I do not have the patience for that. I was not created to do that. Here we are. So,
Well, what an amazing story. And I think for so many of the people listening, we have providers that are operating at a really high level. We have parents of children that they're working to help. And I mean, as I've learned about neurofeedback, the more I realize it could benefit everyone. As I say that with my equipment still sitting unconnected on a table because I know how desperately I need these things. But I've been through neurofeedback with my son, and I think one of the first things that we saw improve was just ability to kind of contain some of the emotion in a positive way, not like suppress it, but more like work through it on a higher brain power level. And then also even sleep quality, just because I don't think he was even as stimulated from just daily life as he had been before he'd done it. So I look forward to doing it again with him because that I'll get to that question in a moment, but I do have questions on like how frequently should people be doing this and why does it vary for people? So can you explain neurofeedback to us? It's something that many have heard of, but I think it's still often misunderstood as to like what it entails and what it could benefit.
yeah, so neurofeedback is super cool because it's non-invasive, it's holistic, no medication required. That's really what got me into it, especially my son, because we were in a really rough spot, but I wasn't willing to put my 5-year-old on medication. I just couldn't do it. So we start off with doing an initial brain map. So we put a cap on the head that has, you've gotten to wear this cute cap. It
Looks
has
good.
19.
I'll post a picture when we put this website up. I'll make it the cover of our
Perfect, perfect.
reels.
Yeah, so it has 19 electrodes. We're reading the electrical activity of the brain. So we're not inputting anything into the brain. We're reading the electrical activity that the brain is outputting, organic electrical activity. And our software puts that into what's called a map. So we're able to see what brain waves and in what areas of the brain do you have dysregulation. And that's really just like a differential diagnostic tool. So we're looking at different symptoms that this kid or adult likely struggles with based off their brain map. I was thinking about this podcast last night and just thinking about the Loom video you sent me, I think it was Loom, for
Yeah.
explaining my son's initial eval. And it was, I mean, I was super impressed. You were like reading his mail just by looking at his airway and, oral structure. I was so amazed when when you saw his tongue, even though it's been released twice. You said we have to do it again. But anyway, you asked if he's really stiff, and I was like, whoa, yeah. Like it's almost a joke in our house because he's very athletic, but he literally like can't bend down and touch. He's so stiff. So I was just like super amazed by that. But the connection I was making is like when I do all these consults, discovery calls with parents, adults, I can really almost visualize what their brain map's going to look like just based off their story, their symptoms, their, childhood, their trauma, anything that's going on. So it's very similar in a way to what you do of like just you can look at it and you know all these things. I
Yeah,
was
well, you're
blown
taking
away.
diagnostic information, right? And then you're saying, okay, I expect with what I'm seeing in this information that this, and this are some of your biggest concerns. And parents are always like, well, how did you know that? And it's because they're like, that's actually true. But I mean, you did the same thing for me because when you mapped me, I mean, you already knew what you would find based on what I told you and like the level that you see me trying to function at. But you're like, do you experience burnout? And I was like, oh, that's interesting because yes. So there are certain things that you would say that you could just kind of understand what my thought process is just by, and that can be like scary to hear in a way, but it's also so validating because it's actually
Yeah,
somebody taking the information and going off of what your brain's actually doing versus me trying to explain it to someone. Because neurofeedback goes well with talk therapy, from what I've read. But for
yeah.
those of us that aren't going to invest in that at this time, like can you explain what happens during neurofeedback as well? Like what happens with the neuroplasticity? Why is it beneficial? How are we actually making positive change? All that fun stuff.
Yeah, so neurofeedback works through a relearning called operant conditioning. So really it's a workout program for your brain. It's like your brain's at the gym working out. So you do 2 or 3 sessions a week. They're for 30 minutes each. And you really, for kids, they're just watching a show, their favorite show, just nothing like stressful, obviously. For adults, they're watching a show or listening to music. And when you're watching a show or you're listening to music, the screen's getting brighter and darker, the volume's fluctuating in the music. And that's where your we're really retraining your brain. So the brightness and the loudness of the volume is giving your brain positive rewards, positive feedback. So we're working on electrical activity, electrical impulses, which really help to create new neural pathways, which is the way that your brain functions and operates. So over time, we're able to create new neural pathways within the brain so that it kind of unlearns old patterns that aren't serving you well and relearns new patterns, new ways of functioning. And it has people like maybe they've heard of the term, but some people are like, what in the world is this? Chiropractic used to be like kind of this woo-woo thing. And now, I mean, everyone goes to a chiropractor.
Mhm.
So neurofeedback's been around since the 1960s. It's not like a new therapy. And there's constantly, just like anything else in like medicine, data, research, ever evolving on it.
Well,
Um,
the hard part, I mean, to your point, you didn't want to put your 5-year-old on medication. So you searched for a modality that ultimately took you time to find. It
mhm,
costs you money and it costs you time.
mhm.
We are so quick in medicine to try to throw a quick fix at something through a medication, and that's not what this is. This is more kind of going back to the root cause and unraveling and rewiring some of the brain. So, talk to us a little bit about some of the symptoms. Like we've spoken about sleep, we've talked about ADHD, anxiety, depression. What other types of things are you seeing in people? And do you often see an overlap of symptoms?
Yeah, I mean, sleep is so huge. And I would say probably 9 out of 10 people are not getting the quality sleep that they think. And a lot of people think, oh, yeah, I fall asleep within 2 minutes. Well, that's also a sleep disorder. Like, you're not supposed to fall asleep that fast.
Mhm.
Sleep is a huge thing. And I think in conjunction with what you're doing and how you're working so well to help sleep. Like these two things, modalities together can make such a huge difference. Certainly ADHD, anxiety, depression, memory, a lot of like behavioral issues in kids I end up treating. And then once we can help the sleep and then we'll work on like anxiety. I see anxiety and ADHD go hand in hand a lot. Sometimes depression too, when looking at it from an alpha asymmetry standpoint. But once we can help the sleep, and then I'll really like work my way down and tackle like more of the behavioral issues. And then we want to get down to like focus and attention. I also can help with like a lot of sensory overload, sensory processing issues. There's such a long list of things neurofeedback can help. We try to like, we can help so many things, but I'm trying to like hone in on certain things. Just because I don't want people to be like, oh, sure, of course it could help
Yeah.
that, but
Yeah.
I mean, it really can.
And we see that in the airway space too. I'm like, I don't want to like go into depth on why like your plantar fasciitis may get better, but it's also like it's a side effect of the treatment you're rendering. Like I'm doing dentistry and making more physical space for stuff, improving on posture of things. But
Mhm,
I was talking this weekend back in Las Vegas about some brain related stuff and how the structure of the oral cavity can impact the function of the brain because it doesn't allow for early movement. I mean, my takeaway is all of this is so connected And we can totally stay in our lane and do what we're supposed to be doing within our scope. But it doesn't mean there aren't other things that people could be exploring on their own. That's one thing I love about the podcast is just being able to talk to people like you so that others can listen and be like, hey, actually, that speaks to me a lot. I'm curious. I want to learn more. So can you talk to us a little bit about how something like what does a neurofeedback session look like? So we're altering volume, altering like the color of the screen. How is that possible virtual? I can see in a center, but how do you manage that for families?
Yeah, so my remote clients, I have a lot in Colorado, also all over the US. So I just either bring you or ship you a remote neurofeedback kit. It has the electrodes, the amplifier, all the pastes and gels, alcohol swabs, everything that you'll need. The only thing the client needs is their own laptop, which most people have, so that's usually no problem. So you basically connect these little tin electrodes to your ears, your forehead, and then one or two on your scalp, depending on what area of the brain we're training, what protocol we're on, what we're working on. And you really just kick back on your bed, a recliner, wherever in your house you can. And I always help people like talk through where in their house they're actually going to train. And you're really just watching your favorite show, or if I make you listening to music for 30 minutes, 2 to 3 days a week. My kids honestly like argue over who gets to do neurofeedback because there's obviously four of them and
Yeah.
they get to go sit in my room in the recliner in the quiet by themselves.
Yeah, life is good, right? It's so I think that's the cool thing about it is it really is specific for people because based on what part of the brain you're training, you have different protocols. So it's not really a one size fits all. A lot of it's dependent on mapping. And what you and I had spoken about is even if somebody is somewhere else, you have avenues to either get that map or based on symptoms, you can say you fit better into this protocol. Is that correct?
Yeah, so I have a lot of relationships with other neurofeedback clinics throughout the US. So if I have a client in, I just started 3 people in Virginia, so I'm sending them to a clinic there. They'll do just the hands-on piece of their brain map. They'll send me the files, and then I'll get on a Zoom with the clients and do all the review with them. And then they'll get going. And yes, to your point, every brain, everybody's life experience is different. The way their nervous system reacts is different. Everybody's brain is in a different place, obviously. So this training is totally individualized for that individual based off what their brain needs, what their story is. We can do mapless training. So I do have a couple clients in like really rural areas that didn't really have access to getting a brain map. So we're training them based off symptoms, and when you train, there's a trend screen. So I can see how each brainwave, like how it's performing on the back end. And that gives me like a lot of insight into how the brain's doing. I certainly try to get a brain map if I can.
Mhm.
That's like, plan A. But if I need to train without one, I can do that and have done that very successfully as well. So, um, yeah, anyone with internet and a laptop that's willing and wants to, regulate their nervous system, really treat their symptoms without medication. And because I said this has been around since the 1960s, there's obviously been 60 plus years of research and data. And all the research backs up that these effects last for up to 30 years. So this is not a band-aid approach. Like, we're really working on the root issues. We're healing the brain. And, it's just one session at a time. Most of my clients train for about 6 months. So it's a process. It's just slow healing. I have a coffee cup that says trust the process. And I
Yeah.
have to remind people of that for sure.
Yeah. So, because, like you mentioned, you started to feel like issues were coming to a head after kids and stress related to kids. But looking back, you suspect that maybe some things were kind of stemming from childhood. Is that what you see in a lot of your patients, a lot of your clients? That maybe we get to a tipping point, but a lot of it was there all along?
Yeah, absolutely. There's a few things that come to mind when you ask that. I think a big thing is most of us, especially as adults, even kids, most of us have experienced trauma to some degree. I mean, there's certainly a spectrum of that, but I think a lot of times people think if they haven't experienced this capital T trauma that they haven't had trauma in their lives. And I often will ask them that on the discovery call, like kind of I want to know their story. I want to know about their childhood. And someone might think they're sleeping really great, for example, or they don't think they have any anxiety, but I see the brain map and their beta asymmetry is at 5%, and anything 50% or lower is like a pretty moderate baseline for anxiety. And they're like, oh, I had no idea. And I'm like, this is just obviously, normal for you. This is your normal. This is how your brain has been as long as you can remember. And as we start to train them out of that, they start to, they'll reach out and be like, oh, I guess I did have anxiety. I'm feeling so much better. Like the way I'm reacting is so much better. My capacity is so much better. Um,
Well, we say the same thing for airway related issues, right? People don't, they're like, well, I've just never been able to breathe through my nose. And I say, well, you know that there's a better way to breathe. And they're like, well, there is, but this is how I've always done it. No one told me. And so I was telling you before we started, like, that's the name of our podcast for a reason, because so frequently it's like, well, no one told me it could be different for me. And this is just always the baseline I've been operating on for my whole life. Like a lot of this stuff we bring with us from infancy and on. So when it comes to training, like you said, most of your clients are about 6 months.
mhm.
What type of expectations should families have either for kids or for adults? Do you find that kids respond more quickly? Do you find adults respond more quickly? Like, what does that look like for you in terms of trends, or is everyone different?
Yeah, honestly, everyone's pretty different. Like I'm thinking of one, kiddo I had the mom certainly has a level of anxiety as well, but I had to constantly remind her, like, this is a process. This is, a marathon, not a sprint. We're not putting a band-aid. And then, she kept going. She trusted me. And I mean, there were little things that we saw along, but he finally got to a little over 50 sessions. And it was like, she texts me of like, oh my gosh, it all just kind of came together. Other kids, within like the first 10 sessions, I'm getting really positive feedback. They're sleeping better, their, meltdowns are a lot better. I would say if a kiddo is having like, a level 10 meltdown, we're going to notice that those are like getting less and less in frequency. And, if it was a 10 on the scale, maybe it's a 7 and then a 5. And always like, I'm really upfront with clients. First of all, if you're not, don't have the time or resources to really commit to this, I don't even want to start people because I want them to see this through and like to get better and their brain to be in a place where permanently it's in a really better place. They're not just feeling better for a minute and then it backslides into old patterns because we do need to get a certain number of sessions in to really like make the change stick.
Yeah.
I lost my train of thought.
I mean, that makes total sense. You can't, just like we were saying, a quick fix. It's if you're looking to unravel a
Yeah.
lot of the impact that our world is having on our health, it can take time. And we say the same thing in airway health. Like we have structures that we can modify, but if you've been with a low tongue posture, if you've been mouth breathing for a lifetime, like all of this stuff, we can make modifications, but it still takes time to retrain the way that we're functioning and what we're
Mhm.
doing. And when it comes to the time investment it takes, don't spend money on something that you're not fully invested in and then blame it on the thing you try to invest in, that it's that fault that it wasn't successful. We see the same thing in myofunctional therapy often. People are like, well, like the tongue tie release, it reattached or you didn't get a complete release. And it's like, well, like you didn't put the work in leading up to or afterwards to train that muscle to be in the best position to go through something like that. We can't expect a miracle. So,
Mhm.
yeah, I think that's really valid for people to hear too, is like if you don't have the time or the resources, then maybe pause, keep it on your radar as something that really needs to happen. But the question is, when can you set the time aside?
Yeah, and it is, I mean, what you do, what I do, it really is an investment in your health and in your future. And if you can see the value in it in that way, like there's no price tag to put on it. There's no amount of time that you couldn't put into this to really like fix and help these symptoms. I find it so funny, like I've had car trouble recently, unfortunately, but and I keep taking my car to the mechanic, and it's like, you have to have a car that works, especially when you have a family and you drop everything to fix it. But we will go year after year after year with a brain or airway that's like not optimal at all. And we wonder why we're struggling, why we feel this way, why can't I sleep, why am I snapping at my kids? But it's like we ignore some of the most important organs and things in life. But well, that I try.
I'm just laughing because I had a conversation with my husband who, people listening to this know I share a lot of family stories, but I was at a surgical forum a couple weeks ago and with people that are excellent at their craft. Like there's people that are good at what they do and there are people that are excellent. Like you're bringing your car to hopefully an excellent mechanic, right? Like good
Yeah.
reputation, you know what they do, they've got a good track record. That stuff can still take time and it's still hard and expensive, but you got to do it. But we
Hmm.
try to put a price tag on health all the time, and you can't necessarily do that. So we're talking about what would be beneficial for him. He ultimately needs what's called orthognathic surgery because in childhood didn't grow as favorably as we could have for better breathing. But he's been breathing wrong for his whole life. He has sleep apnea. He's managed with a mouth guard that's ultimately helping him, but it's not going to last forever. It's the Band-Aid, it's the medication.
Hmm.
And he goes, we talk cost. He goes, that's really expensive. And I was thinking to myself, I'm like, it's less expensive than a new car. It's less expensive than being on medication for the rest of your life. It's less expensive than you dying 10 years earlier. Like, why are we so quick to be like, well, it just costs too much. It's not like buying a handbag. It's buying your health and your longevity. Because when you speak about memory, like how many of your clients would you say are struggling with memory and focus, especially as adults?
Um, 95%, I would say.
Perfect.
What,
Perfect.
what, what was your question? Just
So, do you think that that trickles down into our longevity as we age? Like, how do you think that affects us from like a quality of life standpoint?
Yeah, I get abs yes, for sure. And I would say I get asked about dementia, Alzheimer's, stuff like that as well. And it runs in my family, so it's something pretty heavy on my heart. But I mean, it's like there's so much sleep issues, stress, anxiety, depression that I truly believe, like, yes, I believe there's some genetic component, but I think there's a lot of these things that we could kind of avoid in a way if we take care of them now. Like that's super important to me as a 38-year-old of like, I got to get a grip on this now because I see how my mom struggles and her grandma, and I don't want to get to that place. Like, um, blah, blah. I lose my train of thought.
Well, we
Edit
say often,
that part
like,
out.
all we're trying to do is do better for our families than our parents could do for us. And,
Yeah.
like you said, the literature was there back probably when your mom, your grandma could have even benefited from this, but the access to care, like the technological age has given us so much more information and access to
Mhm.
technology and almost to a fault because you're like, oh my gosh, there's so many things. It can be so terrifying. What should I do first? We talk a lot about in our practice about sleep and breathing are of utmost importance. And for us, our focus is structural. And I would think that a lot of the poor breathing patterns and oxygenation also, and we have literature to back this up, but it impacts cognitive health as well, especially in childhood.
Mm-hmm.
And, these two things really go so hand in hand. And I have a lot of families that have come to us, and sometimes we're the end of the line.
Mm-hmm.
Often we're the beginning of it because they're starting to see crowded teeth and they're like, oh, I hear as a side effect, sometimes they'll breathe better when we do X, Y, and Z. And so there's oftentimes an opportunity for me to say, well, if this isn't getting better, I know enough to help make good referrals for you. And there are many kiddos that the minute they sit in my chair, I think to myself, I, I just because of my own experience with my son and working with people like you and others, I feel like this child would benefit, but I'm not quite at that point where I can bridge that gap. If I were to ask a parent kind of three questions for helping them get support, would you
Mm-hmm.
say that focus, attention, and sleep quality are some of the big ones, or focus, behavior, and sleep quality are some of the big
Yeah,
ones?
yeah. I think those focused behavior, sleep quality are really huge. I don't think parents always realize the like how bad their kids need help with sleep. I think we put them to bed at their bedtime. We do, bedtime routine, put them to bed. If they're quiet, we assume they're asleep. We're not sure. We don't know if they're in there counting sheep for 2 hours.
Mhm.
Um, Often when they're not sleeping well, if they're prone to anxiety or have some patterns of anxiety, that's amplified. They can't focus, they can't pay attention, they can't concentrate. I mean, sleep and diet are so huge with the mental health things. Uh,
Yeah, yeah. Do you see a big impact on diet and stuff like this too? Like when you run a map, are there certain suspicions you have about things or?
yeah, yes, we can see like certainly inflammation and have some suspicions of like gluten, dairy, sugar, certain things that might be irritating the brain for
Mhm.
sure with like the gut brain connection. But yeah, sleep, focus, behavior, I mean, they all kind of go hand in hand, especially with what you're doing as well. And I would say back to what you were talking about earlier is like, I think especially with neurofeedback and even what you do. I mean, I was a nurse for 11 years before I started this business. Our son has had not one but two tongue tie releases. I had no idea there was an airway dentist. Like it truly was like divine intervention that I met you. I really believe
Yeah.
because
Well, and
my
I'm sure
son
you
needed
see
you like,
trends in your world too. Like there are certain times where what we do is subject to criticism or attack, and it's like we just go in these waves, and ultimately it's so foundational, right? Like we need a face that fits our teeth. And as a side effect, it means the airways are a more compatible size for better oxygenation and airflow. Like you
yeah,
need a brain that's focusing and functioning and rested. I just don't understand why it all has to be so controversial. Like it just seems like basic science to me. Like the same thing with the car. Like you kind of want a motor that's running smoothly. If it's
yeah.
shutting off every 3 days, that seems like something's wrong, right? But I don't know. Our medical model is a little funny with stuff like that. So do you
Yeah, I
guys
just think
find that?
definitely a lack of, sorry, I'm speaking.
Oh, go ahead.
Definitely a lack of just education. Like people just need to know that these things exist and that like especially being remote, it's so accessible. It's your kid's gonna ask to do a session most likely, especially if you don't like have this, iPad babysit them all the time.
Yes.
And
Hmm.
and most people that are like interested in what I'm doing, interested in what you're doing, like they're already kind of on top of a lot of things with
Yeah. The diet conversation, like that's something that they've often already addressed. And so it
yeah.
is really nice. And sometimes we get like complete clean slate where you're like, ooh, I think we have a lot of work to do, and I think I can help you with some of it. But I think there might be layers to this onion where then you have other families that are really well educated and well supported already. And you're like, oh, finally, I'm so glad you got here because now this is like piece number six of the ten piece puzzle. And yeah, I
Yeah.
never thought about it like that. It's like a puzzle with a missing piece.
Yeah, it's
And
all a piece of the puzzle. I tell people that all the time because people come to me, like you mentioned, like as the first option, or maybe they've done all the psychiatry, all the talk therapy, all the play therapy, all the things they can think of, and they're still not where they want to be for themselves or their kiddo. And I will say neurofeedback from my experience is like the piece of the puzzle that usually makes things click and like see a lot of improvement. But I'm never going to tell someone, no, don't go to OT, don't go get your airway dealt with, don't go to talk therapy. Like it all is beneficial. Like
Yeah.
it's all pieces of the puzzle that work so well together. And I think when we can see each other as that too, and not like, well, they're going to do that or this. I mean,
Yes.
we're not competitors. We're trying to help the individual. Like we want them to get better. That's why we're doing this.
Totally. And I mean, I gave a lecture this past weekend, and my thought process is like in dentistry, we're trained that like you fix something and it's fixed. And if it's the slightest bit imperfect, it's a failure. And like some of the things that we do, we have, for example, people will come to us and the teeth are crowded and bedwetting's occurring. And like, well, as a side effect, nocturnal enuresis can be reduced when we make more space because it allows for better breathing. But there's also like four other things related to brain health that cause nocturnal enuresis. So a big conversation in our world is like just do the dentistry, which I respect and I do. Like that's what I do. But
Sure.
in my thought process is, well, I can just do the dentistry, but also I can make well-timed and appropriate referrals to also help that human be better. So completing the piece of the puzzle, like brain health is so essential. How do you feel that the digital age and a lot of the social media or even the iPads, the screens are impacting us? And do you think if you were doing this 20 years ago, you would see a different brain than you see now? What are your suspicions?
Yeah, I mean, I think on the plus side, like technology and social media, all this is so helpful so that we can reach more people and educate more people. That piece is great. But yeah, I think the addiction that we have, the comparison, that brings so many negative things of anxiety, depression. We're getting these dopamine hits from the likes and the comments and the screens. And yeah, I mean, you look at statistics and mental health is certainly declining with social media and all the technology. That's super sad to me, especially for kids. Yeah, I believe it would have looked better 20 years ago for sure. But
Yeah.
I'm super grateful that I like have this tool in my tool belt to offer to people that really like gives hope to I talk to a lot of people that are feeling pretty hopeless, pretty isolated, like not sure what to do.
Yeah, it's so interesting that you say that you have a lot of families that have already been through talk therapy, play therapy. A lot of these families are just seeking answers. And I think that's how we often become uncovered. And I think the same thing for you. The hard part is like we're fighting against a system that there's not a lot of reward on having healthy people when it comes to financials. There is for the person, but not necessarily for some of the bigger businesses behind them. So it's so great that you do what you do, and I'm grateful for your journey and that you figured these things out. It's really neat to hear about the options for people that don't have access to someone like you. So, how does it look like to get started? So, somebody would contact you and kind of fill out a symptom
Yeah,
list. Can you talk us through that
yeah.
process?
So I think I made a link for Untethered. If I didn't
Perfect.
send it to you, I will. But you
Great. And we can
just
put that in the show notes.
yeah, and I can even get like a QR code for you to have something like physical in office. But even at your other location, like they can just scan, it takes them to my discovery call link. There's a free discovery call. It's 45 minutes. Before they do the call, there's 3 videos that they watch, like who am I? How did I get started in this? What the heck is neurofeedback? How does it work? And then like, how does remote neurofeedback work? And I have the equipment in the videos so that they can have a visual. Um,
So people can already get access to a lot of the information that you're going to go through to decide if they even want to take the discovery call. Like the time commitment, they already have some idea. So you're just kind of filtering out good candidates
yeah.
versus those that may not be ready, which is awesome.
And then they also tell me like where they are, their age, fill out a list of symptoms. You mentioned bedwetting. That's something we can help with also. I mean,
Yeah.
anything brain related, nervous system related, which is most things we can help with.
It's just so fun and so fascinating. I just love the overlap, and I really like this puzzle analogy because it makes a lot of sense. Like we're not as simplistic as we want to think we are. Like there's a lot of complexities to a human being, and
Hmm.
the body health, the brain health, it goes so hand in hand. So from there, you can kind of figure out like, is this somebody that I could map myself? Is this someone I have access to a center where they could be mapped? Is this someone I may need to do map lists based on their symptoms? I think I can help them. So you're able to tell a lot just from that discovery call and some of the information that they fill out.
Yeah, and then if they're ready to start, I literally just ship them the equipment. They get everything on the back end, like videos of how to set everything up. I'm available, obviously, if they need me, but we have a lot of videos dialed in so that things are pretty automated for people. And then they just start their sessions. I check in with them every week. They do a progress tracker so that we're checking, we're tracking subjectively how they see their symptoms or tracking. And then every session they do saves on the back end. So I literally see their session the same way that I would have seen it in clinic. And they get a video like of me explaining where to put the electrodes. So it's all really easy. All of my clients do a really good job with the remote neurofeedback. I use the same equipment and software remotely that I did in clinic. So the quality is exactly the same.
Yep.
The
And
only
you and
difference
I have
is,
spoken about that a little bit too.
yeah,
Kind of like I said, there's good mechanics, there's great mechanics. Like the quality of the equipment you're using matters. Is that
yeah,
correct? Yeah.
yes, absolutely. And you mentioned like doing things with excellence, and that is like so important to me. When I decided to pivot to remote neurofeedback only, just because so many people were taking that route when given the option, I'm like, there's no way I'm doing this if I can't give them the same quality that they would have gotten, even in like how I check in with them, how I'm tracking things. Like we're even looking at building like a community cohort because people need like healing, I believe really happens in community and like people are really isolated these days, which is really hard. Um,
Yeah, that's one thing we see that a lot in our space too. There's so many communities for like there's one we call it a MARPy. It's a expander, but there's all these folks that are going through this process and like sharing their journeys. It can almost be a little scary sometimes. They're like, "Whoa, whoa, like you're changing clinical guidelines on like the Facebook forum. Maybe let's slow that down." But like connection matters and
yeah.
just having people that understand what you're going through, especially I was having a conversation with a colleague this morning and she goes, "You just seem like you have it all together." I was like, "You don't, we're all having a hard time in some way." Like, but we don't know what other people are going through because we may not have the time or the bandwidth or the desire to really talk about it. Like, you kind of need to find people that kind of get you from the very beginning. And that would be really cool if you built that because I think you would have and it would be outrageously successful. People already know what that person's baseline is because they chose to go this direction in terms of treatment. It's like no judgment, like, well, why didn't you just start medication? Like, it's like, oh, we chose to go for the root cause approach because that seemed like a better idea. So,
Yeah, and I didn't mention it in the beginning, but like our oldest, when he was 2 months, we found out he had a huge hole in his heart. When he was two, he had open heart surgery. The day before, I threw out my back, which was crazy timing, but I couldn't like get on the toilet or up or anything by myself.
poor
He
thing.
later got an epilepsy diagnosis. He has learning disabilities, ADHD. Now the airway stuff, praise God, we are connected, but he's about to have another surgery on another body part. And he's just like, Mom, why is all this happening to me? So I just can level with so many moms. And I worked in labor and delivery and women's health and pediatric intensive care. So I've been on like both sides of a lot of these things. I have a huge heart for moms and kids because it is not easy being a mom, whether you are, single, married, working, staying at home, your kids going to school, they're homeschooling. any scenario is just really challenging. And especially I'm sure you see with a lot of parents and your own kids, like when your kid is struggling, like there is like nothing you wouldn't do to help them. Like,
Yep.
but and then I find a lot of parents, which I can relate to where I was, because I only did this because I decided to do it for my son. But I end up training a lot of parents and kids together because I'm like, wait, what are you struggling with? As I'm talking to them. So, and I find that combination really helps a lot too.
Yep. Well, it's power in numbers and teamwork, and they want to be like us. So why not try to pivot their desire to be close to us? And I mean, I think for my kids, a lot of their existence is just wanting my time. And like one more
Yeah.
thing that you could do together that like is beneficial for everyone. So, yeah, it's so cool what you do, and I'm so grateful that we've made the connection, and I'm really excited to get this episode out and share this information with families. I am asked a lot about my son's personal journey just because I'm really open about it.
Yes.
He's also very like he feels good. He feels like he's famous in a good way, like because he knows how special he is. Like he's brilliant. He's also I've put him through a lot of medical stuff just because I'm like, I will not stop until I can help you be the best version of yourself. A lot of that is airway dentistry related, but a lot of it's all this other stuff that goes hand in hand. And so it is really neat to bring everything full circle and provide access to people. I do think that you having that empathy in your personal experiences, it just women in healthcare are awesome because I do feel that we're really open to sharing parts of our journeys, and it can be a lot less scary in talking to someone like you versus like no offense to like you know a, a grown adult male who's never had to shoulder the same burdens. Like it's just different. It's so different, and they don't see it, but we see it. So I get you. Get you.
Absolutely. And you asked a couple times about like expectations, and I just wrote this down because I didn't want to forget. If someone's coming to me and just say their anxiety, for example, is like a 8 to 10 on the scale, 10 being the most severe, and that's kind of like their day to day. If I tell people if I can get you to like a 2 to 4 by the end of this, like, I really consider that a win. I'm not telling people you're never going to have a bad day. I can't come into your life and change every circumstance. I can like walk this journey with you and encourage you and be as much support as I can. But anyway, I have that conversation with people a lot because I think something, like a 2 to 4 is like very manageable. You can live life that way. Like, yeah, maybe you have a moment that you feel a little overwhelmed, but who doesn't?
Mhm.
But it's no longer controlling your life. Like you can live your life. So I
Yeah,
just,
it's such a good point. I mean, managing expectations, I think, is one of the hardest things to do in healthcare, just
mhm.
because, sometimes people feel like they're at a point where they're like, oh, I finally found the answer. And it's like, well, it's a half of the sentence of the paragraph for what the answer is. And yes, you did just uncover a stone, and
Mhm.
you're that much closer to being where you want to be. And it's low-hanging fruit in a way. It's a way to do things. It's not damaging. It's not something that you have to taper off, like, for example, like medication wise. But I'm sure you see people that are on certain medications and they stay on those, but this is one more adjunct that can help them.
Yeah, typically I will help wean them down, like obviously in conjunction with their doctor. Um, Because a lot of times, as the neurofeedback starts to make really positive changes in the brain, there is a chance that they could notice some side effects of the medication because their dose is likely too high at that point.
Isn't
So,
that crazy? Like
yeah,
you're just leveling. It's kind of like weight loss or something. As you take it down, you're like, okay, your like calories that you need are different because your energy expenditure is different. So that's so
yeah.
wild. And it's cool that you can see those patterns. So are you able to then say, hey, like I think we need to have a conversation with your physician or your psychiatrist about this. Like we're at a point, I'm seeing this trend. Do you help manage some of those conversations?
I don't really talk to their doctor per se, but I do like, tell them the questions to ask and the symptoms and kind of the middleman between that for sure.
And along
Some
those
clients,
lines, how versed would you say physicians are in this? And like no fault of their own. How much do you think they learn about this, if anything, in school?
not.
None, none. Yeah. That's really
I
frustrating.
think,
Like we run into the same hurdle all
yeah.
day. And it's hard because it's not their fault that they never learned it. They were never given the opportunity. So, do you find that if you are to get referrals from doctors, it's because they've had some type of a personal experience?
Yeah,
Yeah.
yes, absolutely. I was just thinking when you were saying that, the job I was doing when I left nursing was I was working at a women's health clinic, and I'd known these doctors my entire nursing career. And neurofeedback, like, literally changed mine and my son's life and really like the trajectory of our family and our legacy. And when I told him I was leaving to start my own business and telling what I mean, I truly believe they all thought I was like absolutely out of my mind, and they probably thought I'd be crawling back there in a few months.
Hmm.
Um,
Yeah, it's
but
so funny.
yeah,
Like we have so many parallels. I basically quit my job and was like, I want to do dentistry different because I see that there's a better way and I see that there's a way that can have a bigger health impact. And I was basically told like that's not a thing. And I was like, but like being healthy is not a thing. Like, don't you think trying to be healthier is a thing? Like, isn't that what people are doing, trying to do? So, yeah.
I told you that ENT recently like laughed at me when I asked him about my son having the tongue tie release with his other surgery because he has to go under anesthesia. He was
Mhm.
like, "No, his tongue is fine." I'm like, "Okay, well, I'm
Like,
not."
okay, well, you may not understand functional mechanics, but you understand structure, but you just don't understand why it functions that way. So it's fine. It's fine.
Yeah, and I agree with you. No fault of their own. I mean, most of them aren't taught they're not even taught about nutrition in medical school. Like, I mean, that they use the tools that are in their tool belt. And this is the
Okay.
tool in my tool belt that I know that works that I'm so passionate about. And
Yeah.
I mean, pretty much every client I've worked with, when they stick to it and trust the process and are consistent, like they get really good results. So
Yeah. Well, I'm super excited. We'll have to, so I'm gonna get started finally. And
do it.
I am gonna get started and then we'll repeat this podcast. It'll be great. And then, I mean, I'm a 41-year-old, high functioning, very busy and stressed out entrepreneur. So I imagine that my map is similar to a lot of people that are choosing to listen to this podcast. So one day we can repeat things or like go back through some of it and like show the change. Because I think to your point about when you have people fill out the symptom list and then you're actually tracking it, that was the coolest thing that I saw with my son. I'm a skeptic, but I'm data driven. And so when I was able to fill out the form saying like these are the things that I'm seeing improve, but then to have the data that you can actually see happening in his brain hour by hour, week by week, that was really cool. And it really valid because I was like, is this like just me thinking it's better or is this actually getting better? And so it's really cool that you have all of that data to back it up, even from the comfort of someone's own home.
Yeah, I think you just forget. Like my postpartum periods were horrible every time, awful. But somehow I had four children. Like you forget how bad you are, like from where you start to where you end. And so I really like to be able to like really track symptoms so people can, really see their progress and from a different lens because you get better and you kind of forget where you were.
Yep. Well, what's your website? Can you say it out loud just for people that are like me that forget to look up show notes afterwards?
Yeah, vitalbrain.com.
All right.
Vital brain.com.
Well, Claire, this has been such a pleasure. I'm so excited for the work you're doing. I'm so excited for the health of your family and everything that you've built. I'm really excited about this just general health movement that this next generation has, because
Yeah,
I think you're going to see people like you really kind of shining in the center of it. I think all of us are starting to see the impacts of sleep and breathing and just being the healthiest version of ourselves. This is just one portion of it. It's really cool.
absolutely. Yeah.
Yay. Well, Claire, I will link Claire's information in the show notes. I'll put the website in there, and we look forward to repeating this again soon.
Yeah. Thank you so much for having me.
Of course.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetherediirwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.